Welcome again, everybody, once again to your Wednesday night webinar. I am Patrick McGrath. With me, my very good friend, John Grayson. Happy to have you here again, John. Welcome.
Glad to be here. Thank you.
Yeah, I think we're going to do this monthly, John. I think this is just a thing now.
It sounds good to me.
All right, let's make it happen. We will get it all set up.
Okay.
A reminder to everyone, your Wednesday night webinar brought to you by NoCD. NoCD, a downloadable app you get through Google Play or iOS. Check us out. And if you're looking for teletherapy across the United States, Canada, or Australia, or UK, we would be happy to assist you with that as well. So check us out at treatmyocd.com or nocd.com as well, too. And we also treat other things than OCD. We've got a telephone ringing. We've got all sorts of things. We also do BFRBs and tics, and we do hoarding as well too. And we even do NoCD 411 sessions if you're looking for some information about OCD for someone who might not quite be ready for prime time therapy. We'd be happy to help out in that situation as well too. So, John, as always, very good to see you. Thanks for being here.
Again, a pleasure to be here.
And a couple of things. I'm just reading your messages to me. Thank you.
It seemed like you didn't know I was on, and I was just watching you, hoping that for your sake you wouldn't pick your nose.
No, I was checking out. I had a Slack message I had on the other screen. I was looking at it. Yeah. No, I was fully aware you might be there lurking, so I wasn't going to do anything. John, as always, feel free to go through the scroll. I usually kind of start at the top and work my way down, but if you're going through places and you see something that really grabs your attention, we can always go to that comment as well, too. And everyone, please pick our brains. We're here for an hour. The info that we give, of course, is informational. We are not your therapists, unless you are our patients who are joining us tonight. But otherwise, we are not your therapists, but we be happy to give you some advice or things that you can take back to a therapist to potentially work on as well, too. So I'll tell you, Jen, some of my favorites are the names that people come up. Here is high IQ of 190. What a great name. I recently got over COVID, and I'm afraid of the damage it's done, and then I'm going to drop dead if I do any exercise. I'm constantly checking heart rate and blood oxygen levels. I'm scared to death. And again, I think I'll die, but I'm also scared of getting the vaccine because I've seen videos of people dropping dead. Also, what do I do? John,
go on.
I was just saying, we're all going to drop dead at some point, and we'll just put that out there to begin with, whether it's COVID or vaccines or not. So, yeah.
I know, and I was trying to figure out, do we start with actual facts, because I hate to be reassuring, or start out with that, the thing about his rituals that are really sad, that constantly checking your heart rate and blood oxygen levels isn't going to protect you.
No.
It's going to basically do nothing, because heart rate's not really that great a measure of, are you about to have a heart attack?
Right.
And generally people don't suddenly, I think if he drops dead of a heart attack, it's got nothing to do with COVID, but he could still drop dead of a heart attack.
It is possible, right?
Yeah. I mean, and I think, like I would kind of always say, everything is the odds,
right?
But low odds events happen. So the issue is, do you want to spend the next 50 years doing that? And I think to cope with odds, it's always the same thing, which is, I have to risk dying. I don't have a choice. I do think, and I hope he doesn't do this, but I think it's statistically safe to say that he's more likely to die in a car crash. So if he's afraid to exercise, which is likely to make his heart weaker and more likely to die, but overlooking that ritual is going to kill him, he needs to stop driving cars.
Yeah.
If I have to avoid those things. And so the goal isn't to know that you're not going to die. The goal is to try to make it like dying in a car crash. Like, it might happen. And most people, unless that's a specific fear, right, the brilliant plan is, hope I don't die, and I'll deal with it while I'm bleeding out, crushed under the metal.
There you go. Yeah. There you go.
So now that's a hard state of mind for him to get into, but there is no safety.
One of the things I've seen, I'm interested in your thoughts on this. One of the things I've seen in OCD is that people will come up to me with the excuse all the time, but I have to drive in a car. So then it's okay somehow that wipes the slate of that experience and those statistics. But I don't have to get the vaccine, or I don't have to be around people and maybe get COVID. So then that would be bad in that case. Right?
Yeah. And of course, you don't have to drive the car.
Right.
And how often are they driving the car? Of course, now nobody goes to movies anymore. But how often are they driving the car for non-essential things?
Yeah.
You
If
know,
it's not the grocery store or back, then why?
Yeah, and I'm sorry, if it's risking death, why would you risk death? It's like, oh, it's okay to risk death for this.
Yeah.
But um, I think in coping with possibilities, the answer, though, is always the same. I have to take the risk of coping with it, and I hope that I'll cope with whatever happens. Um, I don't get to escape.
There's a great, it's called Letter from an Irish Mother. I don't know if you've ever seen it, John, but one of the lines in there is, your father read that most accidents occur within 3 miles of where you live, so we've moved 5 miles away. Which I just thought was great. I love that line. But that's kind of almost the logic of some of these types of things, right? Where
Yeah.
I've also seen, I remember having someone years ago who we saw, and they were in horrible shape. They were overweight, just going up one flight of stairs. They were winded and everything. And they felt that if they exercised, it would put too much strain on their heart, and that would cause them to die. But now they were in such horrible shape. Their blood pressure was up, their weight was up, that they were in worse shape having not exercised than what they would have done had they exercised.
Right. And so for high IQ, I mean, the answer is simple but difficult.
Yes.
The odds are the vaccine is safer than not vaccine. That's the odds. Does that mean the vaccine won't kill them? No. But do you want to go for the higher kill or the lower kill? Not, and quality of life in terms of, he knows what doctors have told him. Everybody's basically saying, probably you're okay. Do you have long COVID? Maybe. But until somebody tells you don't exercise, it is less risky to exercise. But does he want to guarantee, we all have to accept that we don't have a choice.
Right.
And I say we don't have to accept, and the thing that makes me feel bad about saying that is, I would never say to him, you need to learn, you need to accept the fact you're going to die. I would say you need to learn to accept the fact you're going to die, because it's not so simple as like, oh, okay, I accept that. It is a painful, difficult working out. But coping with the fact you're going to die, at the very worst, it's better than not coping.
Yes. Yeah. And then I wonder if it also makes it seem like if all of us did enough checks, we could prevent ourselves from ever having any diseases at all. I wonder if I should be angry at Susan for having died of cancer, and maybe if we had just checked her blood pressure and pulse ox and a few other things before she was diagnosed, we would have been able to stave it off longer, because we would have somehow figured something out, that something was coming or something like that.
Yeah, and the answer is always definitely, maybe.
Definitely, maybe. Yeah.
but probably not. I say to people in a way that sounds depressing and scary. I'll ask them, do you know what saves our children? And the answer is luck. Most of the time, they don't die in a car crash. They don't get kidnapped. They don't fall down their stairs and crack their head. They don't get leukemia. But it happens sometimes.
But it happens. Yeah.
And all I can do is enjoy them while they're here.
Yeah.
And acceptance, and I think we said this last time I was on, acceptance sucks.
Yes.
It's like it is the second best life, but the alternative doesn't exist.
Right.
So I'm hoping he can decide that he would like to learn how to live with uncertainty and taking risks, and then further pursue what it takes to, to go through that learning. But I don't know. I don't know a way to be certain, so I don't know a way for him to get around that.
Right. Here's a good one. Can you please elaborate on emotional contamination, like having blasphemous thoughts that contaminate objects, tasks, days, etc.? Thank you. I've always loved emotional contamination. The notion that as I've walked past something and had a thought, that thought has transferred to that thing, and now that thing holds that thought or that image or that urge. And it's almost kind of a cue, maybe in the future then, oh, that's right, one day I had that thought while I walked past this thing is now bad because it's a reminder to me of that thing. And it itself feels as bad as the thought did, or the image or the urge.
Yeah. And I think to be a little more specific for that
Sure.
person, one would want to know in what way, what is the feared consequence of emotional contamination, right? Because that can be really variable.
Mm-hmm.
Like, yes, I can be contaminated by my thought or whatever, but what is the cost of that? Now, from what this individual says, they mentioned, the thoughts being blasphemous. So I don't know if those objects are somehow now, hell-bound objects, and, they will contaminate things and either, cause or harm to them, other people. And I guess the question about treatment is, because, we're always talking exposure, but before somebody can do exposure, the question is, why would I take that risk? I'm not going to say emotional contamination. I know one doesn't exist. Why am I going to take the risk of my worst fear occurring? And I think we can come up with a few reasons. And for the person, though, since it's religious based, seemingly, I would want them to pray for too. At least two gods going there. They have the nice good God, and they've got a pretty crazy one. Who's going to permit these things to happen. And you and I know we know which God is right. Actually, right, it's a guess. I have to pick a God, and I always tell people with religious things, like, I can't prove there's God, I can't prove there's no God. Both are an act of faith. And most people make a guess one way or the other. So here you have these two gods, and I know one of them as the OC demon. Because it seems a pretty crazy one that I can emotionally contaminate things with blasphemous thoughts, and that kind of spreads it around, which, and I'd like to know, do they have this power, or does everybody have this power? Because if everybody's got this power, wow, I think every object is damned. Certainly anybody around me, but how does that work? And is that the way God works? And so, they're taking a risk. Which God are they going to put their faith in? But they also have to remember that whichever God they pick, they're insulting the other one. I can't hedge my bet. So am I going to believe in what's seemingly the crazy gods, or do I believe in this good God? And I can't prove which one it is, but as long as I'm making a guess, I might as well make a guess to a God that I can love. Because that one, I mean, I always feel like, if I'm going to go to hell for picking the wrong religion, that's a crazy God to me personally, because God hasn't spoken to me and told me exactly which one is right. Because he opens the heaven and say, go Hindu. It's like, I'm there.
Mm-hmm. Did you ever see the South Park version of this?
Oh, no, I'm sorry. I have not.
So there's the gates of heaven, and all people from different religions and faiths. So they've all got signs, and the doors open, and St. Peter comes out and says, "It's the Mormons," and they're like, "Woohoo!" And everyone else is like, "Oh man, turn!" And that was their take on it.
But it's right,
Mm-hmm. Yeah, it's very, very. I mean, I love sometimes their take on things, obviously, but the other, I'm going to go away from emotional contamination just for a second. I think my favorite ERP I might have ever done there's two. There's standing at a train and telling someone to push me into a train for 3 hours. That was really fun. But the other one was someone felt that they could detect contamination. And I've seen this, whether it's emotional contamination or germ or whatever it would be. And so they thought that the tables in the hospital were really contaminated. They didn't want to go near them at all because they saw the guy who just took the same rag and swished, this one and around that one and everything like that. So what I said, all right, I'm going to do a test. And what I did is I took a Post-it note and I wrote a number on it. I think I wrote like 14 on it. And then I put it in an envelope. And then I took 25 Post-it notes and I put them on the board. And then I took the tip of a pen and I went into the cafeteria, and it was the non-ink tip, and I touched it to the table, and then I touched number 14 Post-it note.
Got it.
Yeah. And this person had convinced me I can detect if things are contaminated. I just know. So I said, great. I just want you to run your hand over each one of these. And I want you to tell me only one of them has been contaminated by the tables in the cafeteria. The last one they picked was the one actually, it just turned out perfectly that day. The very last one they picked was the one that was actually contaminated. So
along those lines, one of my favorite things to talk to people with contamination where, bathrooms would think would be a problem is I ask them, what does almost everybody in the bathroom do before, that's really contaminating?
Before
they wash their hands.
There's a lot of things touched, that's for sure.
They pull up their pants or dress, and the odds that they don't touch that area again are slim. So and most of the time they say, like, if I have just peed and I touch a wall, they don't want to touch that wall.
Right.
So basically the majority of the population, they pull up their pants or whatever, and then they're going around contaminating everything. So everybody's pretending that the world's not contaminated with the bathroom.
Dirty pants.
Dirty pants that they touch, and and yet the world is actually totally contaminated. So why would I take this risk? Well, I mean, one thing is, how can I actually avoid it?
Yeah. Where isn't there feces is what I want to know. Is there a place that there isn't any? Because I don't think there is. So.
Well, I think since a lot of since I mean, if you want to count microscopic dust mites, I think a lot of the dust on the floor is mite feces. So there is that.
There is that.
And so I think we're all covered that way, so to speak.
It's amazing how we've evolved and survived. Right? So
it is.
Back to Nushin. So the belief that something has a emotional contamination on it doesn't mean that it's true, right? Part of the thing we always want to get across to people is just because I believe something doesn't mean it's true. And I would bet that John or I could walk past the thing that you felt was amazingly emotionally contaminated. We could even handle it, manipulate it in some way, and probably not at all feel any form of emotional contamination if it were in our hands. Yeah. So
I would also want to ask him, and this isn't proof of anything because low probability events happen, but whatever he's fearing is the consequence of emotional contamination. If we could prove, we can do a test to see if it's going to happen or not.
Yeah.
The consequence. And we're just going to ask him to make a bet.
Mm-hmm.
And, if he has a loved one, we'll bet their life.
Mm-hmm.
If he doesn't have a loved one, we can bet his right hand. And the bet is he just has to bet whether he thinks it will happen or not.
Mm-hmm.
What are the odds? And if he doesn't bet, we're killing that person or cutting off his hand.
Mm-hmm.
So he just has to make his best guess. That doesn't mean he'll be right, but it doesn't get any better than that. And we're just always making a guess. And we have to, maybe the guess is wrong. Okay. But what are the consequences of you giving into OCD?
Yeah.
And we know that's not good.
And OCD, I suppose, is making a guess too. It just always turns out that OCD's guess is the same. And that's what's the worst case scenario that could come out of this situation.
Well, it should never be able to be possible for it to happen, period.
Yeah. Mm-hmm. Yeah. But what if?
Yeah, yeah. And the answer is what? Yeah, and my answer is, well, okay, what if it is?
Yeah.
Then what? How are we going to live then? Because I can't imagine whatever method he has of emotional contamination. I can't imagine how to not have emotional contamination.
Right.
I can't imagine learning to not have it control me.
Yeah. Yeah. As I box up now all of Susan's things, they all have some kind of feeling or association with her. And are all of those things emotionally contaminated? Or is it natural that things have potentially associations with them? We see this in hoarding as well, too, right? Why do you not want to get rid of that shirt that your child wore the first day of first grade? Because what if that means I'm throwing away a memory of my child? Wouldn't that be awful and horrible of me to do such a thing, right? Yeah. So.
And the answer to that one is, what do you want your kid to have to throw away when you're dead?
Right. Which is what I always ask, because they're going to throw that shirt away because it's been through 3 floods, it's moldy, and it has been eaten by a mouse, and there's 4 holes in it as well, too.
Yeah, when I moved from Philly to California, I decided that my son doesn't really want to have my Cub Scout medals.
No.
it was just a thought,
Yes, that's true. Any ones that you wanted to jump to, John? I'll let you, if you want to pick one, please feel free.
I'm looking at the Peyton, who's talking about people that they've dated and feeling guilty about thinking about people they've dated in the past.
Oh.
And they feel guilty for thinking about their ex.
Mm-hmm.
And just so you know, Peyton, you say you feel nobody really mentions intrusive thoughts about somebody's ex when it comes to ROCD.
I hear it all the time.
yeah. I think there's always, there's always some thoughts that somebody has that makes them feel guilty with ROCD, and I guess their assumption is that they should not have any good thoughts about their ex when there was somebody new.
Mm-hmm.
I'm just guessing. What do you think here? What do they?
Yeah, I would go with that. That I'm not supposed to. If they're not in my life anymore, they shouldn't even be in my thoughts or my memories anymore. Too, the slate should be wiped absolutely clean. I think of the Jim Carrey movie Eternal Sunshine of the Spotless Mind, where the company should come in at night, remove all memories of the ex from my brain, so that I never have them in my head ever again. Right?
Yeah, I mean, they say they have multiple intrusive thoughts, and of course, I would say there's no such thing as an intrusive thought.
Right. There's
all
just
thoughts
thoughts.
are normal. Yeah.
Mm-hmm.
Now if we're going to talk about an OC thought, I can have an OC thought, but to me, an OC thought is not defined by content. It's OCD if I do one of two things. I want to know what it means, or I don't want to have it.
Yeah.
I do one of those, it's over. So thinking about, and the idea that, I'm assuming they feel guilty, so I'm guessing it has to do with regard to somebody else they're with now. Like I shouldn't be thinking or comparing them to my ex. I think that's kind of normal.
Yeah, I bet you dated people before your wife, and they might pop in your head once in a while.
Well, we did start when I was 2 years old. But,
okay. Maybe not.
Yeah. Other people might do that.
You would never. You would never. You've never noticed anyone else either, by the way, ever.
Never noticed anyone else. I mean, I'm glad they don't confess because, it is normal to look around and you might see somebody who's really good looking. And, when we've worked with people who are OCD who tell their partner something like, oh my God, I have to tell you this, I feel really bad, but there was this person down the street, like they were so much hotter than you. It's like, normal thought, but most of us know not to say that.
Yeah.
It's like, and so, and feeling guilty, we don't know how to make people not human. And of course, if you decide you don't want to have a thought, that's going to be the thought you have.
Yes.
Exactly. As soon as you say don't think about it. So they'd have to decide they want to learn to live with having those thoughts.
Mm-hmm. And
right?
accept that those thoughts are going to be, there's our favorite word again, accept the fact that thoughts we don't want to have are probably the thoughts we're going to have.
Yeah,
Mm-hmm.
yeah. Mm-hmm. And of course it has, again, the thing that we would need to know from Peyton is, they're telling us they're guilty. So that tells us that they're afraid they're a bad person. He says it's ROCD. So is he a bad person, or is he comparing his current lover to a past lover, thinking maybe the past one was better and now he's bad because shouldn't he tell her that he's not really sure I don't know which set of things he's fearing. All we know is you're not currently ready to leave the current person. So we ask you to stay with them. But, if you want to know, is this definitely the right person for you? Definitely, maybe.
Definitely, maybe. I believe there's probably 10,000 people out there for you. It just depends on which one you meet first.
Right. Right. Or as I like to put it, there might be 100 things I want, but I'm only getting 80 of them.
Yeah.
So if I'm getting 20, that might be a problem, but there are certainly a lot of combinations of that 80.
Mm-hmm.
Peyton, you mentioned it's one of the worst thoughts he's ever experienced. I'm reminded at a support group, I did something that I'll never do again. I said, if you could have a different form of OCD, what would it be?
Mm-hmm.
Now, that made everyone so angry because, somebody would pick a different form of OCD and somebody who had that's like, no. Yeah. Because the worst form of OCD
is your form.
Right. Whichever one you've got now, that's the worst. And so.
Well, I loved in support groups. You always knew the new person was going to come in. Someone else was going to be talking, and that person was going to say, "Oh, I wish I had that kind of OCD. That would be great. Why do I have to have this one instead?" Made West says, "I've got a new job. I really like it, but I'm afraid of what if I get burned out and I don't like my profession anymore? Is this a theme?" Well, I'd say anything that could start with what if could become a theme of obsessive compulsive disorder. So it just have the what if followed by whatever's important to you. Bam, OCD can grab onto that because boy, OCD sure does love something that you love.
Yeah. And I think her solution is simple. But I don't want to. But I just want her to understand. When I say simple, I do not mean easy. I think it's very hard.
Mm-hmm.
But I mean simple, like marital therapy is complicated and hard. What she has to do is simple and hard because the actual answer is, well, what would you do if you burned out?
Mm-hmm.
I mean, it is true if you want to take a job now and know you're never going to burn out. I don't know how to do that. All I know is, what will I do at that point in time? Reminds me, when the pandemic came and people are going like, I can't put up with this all summer.
Mm-hmm.
In the back of my mind, it's like, really? What are you going to do?
Yeah, right.
And in fact, what did everybody do? They put up with it. So if she suddenly hates her job, his job, her job, then they would have to look for another one. Would they find something that they liked as well? Maybe not.
Maybe not.
Mm-hmm. But I would hope they would keep exploring it. Or if they were stuck at that job, well, I hope they would make the best of it while they were looking for something new. And of course, it'd be nice to enjoy it while they've got it.
Yeah. I love this next one. Peter says, after stopping the compulsion I had of repeating affirmations constantly in my head, I realized I had forgotten how to think. And my new compulsion became to find out how to think. Help. I'm going to disagree with you, Peter, that you forgot how to think, because if you forgot how to think, typing that answer out this question out would have been absolutely impossible for you to do. So I'm going to challenge you right off the bat there going, what does it mean to you that you forgot how to think? Because I'm not seeing any evidence of it. So I think you're more afraid of what if you were to forget how to think, or what if you're not thinking in the same way that you used to think, which is what OCD will do, is put in doubt into something along those lines. But I love the worst case scenario jump to I forgot how to think. I mean, that
Right.
that I think is a great example to everyone listening, the extremity that OCD will take it to get you to try to believe something.
Well, how do I know if I'm really thinking the right thoughts that I
Well, there you
really have versus they're not? I mean, thoughts are coming to my head, but I don't know if these are really the thoughts I would be having, or if these thoughts are really meaningful thoughts, or because I'm not getting the feeling that they're like the right thoughts, and I don't mean like right, like they're good or bad, just like that they're like sincerely my thoughts, and I can't really tell that they're mine because, so like I don't maybe I'm just wandering and I don't know what to do about that because how can I have a thought to make sure that this is what I would be thinking if I like knew how to think because I used to just kind of think without thinking about it. Now, as I'm talking about this, I don't know really what I'm doing because I can't tell if this is like what I would want to be thinking about, and this is really boring to myself, and I hate that I'm doing this, and I don't know what to be thinking about. And
Yep.
I think that, as you noted earlier, where we can't, I think we can certainly validate that this is like a very difficult form of OCD,
Mhm.
and treatment's not going to be like to get you to know how to think.
Right.
Treatment's going to be helping you focus on things that you have some belief you might like.
Mhm.
You say you don't know how to think, but I feel like if I say watch TV right now, you're going to have preferences for what you want to watch and not watch.
Mhm.
You want to eat dinner right now, you're going to have preferences for what you want to eat or not eat. And
Mhm.
in some respect, part of treatment is going to be taking the risk of doing those things and living with the doubt that these are not right thoughts or they don't feel like right thoughts. Um, I think as soon as I want a feeling of things being right, it's not going to happen. You know, and it's kind of a just right OCD, except he's focusing on thoughts, and we don't get a right feeling.
No. I've never met anyone with OCD who said, I finally did enough OCD things and finally got the right feeling.
Right.
It's just never happened, right?
Or it might happen after hours for a minute or so.
Yeah. I had great conversations with Alec all the time about the entire goal of getting people to learn to live with doubt, even though they've already lived with doubt, but they forgot how to live with doubt for this one area, is just
Right.
to say, you already do this 99.99999% of the time. You're just not applying it to the 0.0001% that you need to.
Right. I like Ali A here. Is it Ali? Yeah.
Okay.
Who I want to study when I want to study intrusive thoughts repeat in my head again, again and again. Don't let me focus on my studying. And again, he has this idea that he shouldn't have the thoughts in his head. And I would ask him, and he might try to think about this while I'm speaking, if you were about to study and you have your intrusive thoughts, and I want you to keep studying, but I'm saying to you, for the next 5 minutes, they're going to batter you. It's going to be full strength and then stop forever.
Mm-hmm.
Would you be okay with that? And I'm imagining he said, oh, yeah, for 5 minutes, I'll put up with it.
Mm-hmm.
And of course, the question is, they're the same whether it's going to be 5 minutes or 5 hours. So you're actually handling them differently.
Mm-hmm.
And I would then ask, and I mentioned this I think the other week, but I have a limited repertoire, so it's a good one but limited. But I would ask Ali that if he has a loved one and they died, and it's 3 weeks later, would thoughts of them pop in your head? Would it interfere with what you're doing? And would it be upsetting? To which I
Yes.
think he'd say yes to all that. And then I would say, would you and everybody else consider that OCD? And he'd say no. I
Okay.
hope.
Mm-hmm.
And then I say, these two situations, the 5 minute situation and the loss of a loved one, are the same.
Mm-hmm.
Dramatic pause while they try to figure out what the heck I'm saying.
Mm-hmm.
In both situations, they've made a decision without realizing it. In the case of death, they don't call it OCD because they've decided, oh, that's normal. Those thoughts can be there.
Mm-hmm.
In the case of the 5 minute situation, they made a decision. I'm willing to put up with it for 5 minutes. I'm not willing to do it forever.
Mm-hmm.
Which in a way is backwards. It makes much more sense to give up for 5 minutes than forever. It really would make sense to learn to do it. So the goal of treatment would be that we would help you learn to, be studying why the thoughts are there. I mean, right now you are giving more attention to the thoughts because you're saying they can't be there. And so it's not a simple decision, as I feel like it would just repeat endlessly. It's a learning process, but you're not getting better if your goal is not to learn how to study with the thoughts there. And of course, certain things might be okay to study with, air conditioning, noise in the background, whatever, depending.
Yeah.
But like, I don't want these thoughts, So anytime we're doing treatment, I would actually make sure the thoughts were there.
Right.
I might have a tape, reminding them of the thoughts why they're studying. That would be part of the exposure, because we're trying to help remind them I'm learning to do both at once.
Correct.
And in a way, that's a key part of acceptance. I live in a world where I do two things at once, not either or.
Yeah.
I'm studying and this crap is there. I'm studying and it's terrible. My mom died 4 weeks ago, as opposed to I'm doing either or.
Roan says, "Oh my God, it's the reunion tour I've been hoping for."
Well, I love them.
Yeah.
Good taste.
Good taste. Is there any limit to what OCD will make up, even if someone knows it's completely magical and impossible? I haven't found a limit yet. I don't know about you, John, but I haven't found a limit.
I feel that the limit of OC targets is the limit of human imagination.
There you go.
Period. So anything. And, yeah, there is no limit on targets or feared consequences for that. Right. I can fear contamination, but what I'm afraid that contamination will cause can be, as simple as it's too icky. I'm going to get sick. I'm going to, kill, it's going to make everybody else sick. Or it can just get something that seems, less obvious, more magical. So, yes.
Any you want to grab there, John? I'm happy to look for a few others too.
Well, Daniel Rivera, how can I be okay with not remembering people's names? I feel three ways about that. One, I'm really old, so gosh, names are constantly going out of my head.
Yeah. What's your name? Hi, I'm Patrick. What's your name?
Well, hey, I got your name down because it's on the screen. The other thing, I also happen to have prosopagnosia, face blindness.
Mm-hmm.
So I will not, not with everyone, but I will not recognize people I know. And to give an idea of how it can be, a couple of months ago, my wife and I were eating dinner with a good friend. And she and my wife went to the bathroom. I paid the bill. I come out. And I'm sitting, I see this woman walking down the hall, and I'm staring at her because she looks interesting.
Mm-hmm.
And then my wife walks up next to her, and I realize it's my good friend and my good friend who I just spent 2 hours eating dinner with, and I didn't know her.
Yeah.
Daniel is certainly making a lot of assumptions about what people are going to think of him for forgetting names. And, at worst, he'll be known as a person who can never remember anybody's name.
Mm-hmm.
It's like, I mean, because I really forget people, because I really can't recognize people, I kind of warn them. So if they see me in the street and it's like, hey, I'm not icing you or acting weird, I really don't know who you are. But, I wouldn't want to confess to everybody, but if I run to that person, I can't fake it.
Yeah.
It's like, I am so bad at names, and, he can't stand it. And I guess he's making assumptions of what they'll think of him. I think in the end, they'll think you can't remember names. Will they be insulted? And I'm thinking of the 5 magic words here. Because, if I met somebody who forgot my name, it might be like seriously, but I'm not going to really like hate them for it. And so I think to myself, if that's how they're going to judge me and hate me, I would want them to pull out the five magic words. And I think it's generally a better in your head thought. And I like to be generous because I really don't know what people are thinking.
Mm-hmm.
And whenever I tell people the five magic words, they always mess it up if I ask them 2 weeks later. So I like to think to myself, if they're thinking X, sorry about doing this on air, Patrick, the five magic words, they can go fuck themselves. Now, because some people will start to say, if I ask them a week later or something, they'll say like, "Oh, it's I don't give a fuck," and it's like, no, you do care. That's not true.
Mm-hmm.
But if you wouldn't reject somebody for this, then why are we? Like if somebody's going to judge you for that, then pull out the five magic words. And I am dead serious,
Mm-hmm.
because it's like, why am I going to let them judge me for that?
Yeah.
So again, I hope that as we're saying these things, these are all just like the beginning of treatment. None of it's treatment. None of it's that simple.
Right. Mm-hmm.
But I hope they incorporate some of these things.
I'd like people to say that to their OCD as well too. Hey OCD.
Yes. Yes.
Just go. Yeah.
OCD, my panic attack, and if I make a zillion guesses, they seem to be free, and they suddenly had a panic attack, and OCD popped up afterwards. One that's really common, right? I see a lot of people that their OCD starts with a panic attack, and I think there's a few answers. The first one is we don't really know, but followed by, logically, I think for a lot of people, if you've never had a panic attack and you have one,
yeah,
it's life altering for some people. Yeah. How can that happen to me? What, and it's suddenly it's as if suddenly anything is possible. For a lot of people with panic attack, their fear is either going crazy or they're gonna, maybe they're not real. I don't know if that's her fear, but if it is, that's common. That's common. And there's if it is the going crazy, there's OCD stories I did with somebody on this who had that problem, but because the panic attack is a little bit traumatic, and for some people, particularly if I'm a good rule following person, where I've always done the right things and I expect my life to go a certain way, and the panic attack is like blows life up. I mean, I guess if I go off on another tangent a little bit to explain what I mean by trauma, all women know that they could be raped. But right, they don't take it seriously. It's like the car crash. And if that happens to a woman, everybody, they focus on the horror of the experience because that is certainly really important. But for them to recover, there's another step, because that poor woman, she now lives in a world where she can really be raped. It's no longer like, oh yeah, it could happen. It could really happen. And it could happen again. And she is being asked, be happy in a world where this can happen to you again.
Mm-hmm.
And, at the point where she's coming to treatment, in her head, that's a screaming no.
Yeah.
There's not a choice. That really is the goal, but that's it. And so the same with this panic attack, it's kind of shattered all the rules they have. And like, what are the rules now? So we can talk about exposure and everything, but they're also having to be living in this new world where they don't have a system of rules that work. I mean, that may not be true for Nadia, but it's often true. It's like, okay, what is the new system I'm going to have to come up with to cope with the world that this could happen to me, even though I did nothing to deserve, I don't know why it should happen.
Yeah. If you watch on the Dateline NBC Edna Foa PTSD, and you can get it on YouTube. You can go there. They actually interview a woman who had that experience, and it was her second time that it happened, and she says at the end, "I live in a world now knowing it could happen again."
Exactly.
And then she says, and I'm okay with that, right? And it just, the power that someone can do by using ERP based principles in treatment to be able to get to that point. So if whatever awful, horrible experience someone has, ERP based treatments can still get you to be able to live in the world knowing I can handle this.
Right. Yeah. It's a second best life, but she did. I need to answer Sabrina, who thinks I have no fears. That would be cool. I'm not really. There are a lot of things I'm currently not afraid of. However, I'm aware. I like to think I would cope with certain bad things if they happen. I'm not arrogant enough to say I would cope, but I know that there are people who have coped, and I hope I would be like one of them. But I believe with a high degree of probability that if I go blind, although I hope to cope, I believe I will have at least a month of devastatingly severe panic attacks where I'll be partially thinking like, I can't take this, kill me, and another part of me like trying to hang on. So I think that would be really terrible. Now, I guess what I don't do is live in fear that's going to happen. And please don't happen. I hope it doesn't. I hope I cope when if it does. And all I've got going for me is the odds, which don't protect me. But so I guess I fear that one.
It's interesting you bring that up. One of our colleagues, Ashley Smith, who's in Kansas, who has macular degeneration, just did a TED Talk on this very thing, talking about anxiety and bringing in her own personal experience of her losing her eyesight slowly over the course of time.
Right. Yeah. I hope I cope. Yeah.
Ryan asks, what are your views on OCD and alcohol abuse? Well, it happens, and it happens, in fact, far more often than we think it does. It's actually a pretty significant concern. I am very good friends with Margaret Sisson. Margaret is the director of the Riley's Wish Foundation. Her son, Riley, had OCD and discovered at 16 that when you drink half a case of beer, your thoughts shut down for half an hour. And Riley turned to alcohol and eventually to other drugs as a way to cope. Riley went through numerous treatment centers, but failed at them because if he was at an OCD center, he wanted benzos. And if he was at a center that was treating the drugs or the alcohol, he was doing rituals and missing groups, and he was getting kicked out of everything. And Margaret was great and got him on the path, figured out what he needed for therapy. And unfortunately, Riley was at a party and someone was handing out what they said was Klonopin, which was not. And Riley is no longer with us. And it is sad and unfortunate, and no one talks about it enough. But it is also why now every first or second Monday of the month, we just did it this last Monday, and we keep doing it. Stacy Conroy and I, who are the co-leaders of the OCD and Substance Use Disorder SIG for the International OCD Foundation, do a webinar here through this very platform as well, too, where we talk about the inner linkings between obsessive compulsive disorder and substance use.
And I guess for Ryan, he's got to find 2.5 things. He has to be willing. He has to be willing to learn how to live with his puro. Because again, whatever the theme is, I don't think I would, be willing. And actually, I'd be. You would probably do this really well. I think whatever nasty thoughts he can come up with, we can come up with worse.
Probably.
And we do that. So he needs help with both exposure and coping with the thoughts, and he needs help with the addiction, in a very serious way.
Absolutely.
I don't know. I don't know if he's currently, he needs at least inpatient, depending how addicted he is, to detox. But then he needs lots of support to stay that way, and he's going to need people like, if there's, it would be worth it having AA or people, a lot of people around to make it harder to drink.
Yeah.
But then he also has to have this other treatment, and and he has to be willing to risk everything. And his theme is religious.
Mm-hmm.
I still would have a million questions.
Del Cell brings up one, and you wrote a little article about this once in the International OCD Foundation newsletter, the recommendations for ERP for staring OCD, or as we call it also, ocular toretic OCD.
Is there a question? No, I know.
Well, I think it's interesting just to discuss a little bit because, I mean, for those of you who aren't familiar, it's of course being very concerned what you're looking at, where you're looking, and are you looking too long, and what if you did look there, and what does it mean, and did people notice you were looking there?
But mainly staring at genitals or breasts.
Mainly, yeah.
Yeah. I mean, and as the people always want to reassure everybody, and it's true, it's not, they are not wanting to stare. Their eyes literally drift there. And at one point we thought, I thought I had discovered the secret for real, because it was like, generally, I thought it was occurring when they were speaking, not when they were being spoken to. If we're one-on-one, because if you're speaking to someone, generally, you got to give them eye contact to make sure that they, that. But when we're talking to somebody, we don't really stare at them. We kind of, our eyes will wander around. And my theory was, oh, that's when their eyes wander down without realizing. Turned out that was wrong. It seems so good. Well, it was like, I think there's a small portion of that. And we called it, visual toretic OCD. I think it's the current name we gave it. We made up that name.
Okay.
I mean, in a sense, is it really toretic? No idea. It's a little different than regular OCD because the staring is not done on purpose. It's not a literal ritual where they're trying to stare and that they're trying to fix something. There's one group of them where they're afraid they're staring and they're not. But there's another group that actually stares, not as much as they think, and they often do a lot of weird things to try to avoid staring. And I mentioned that because sometimes they'll think people are looking at them weirdly and they think it's because they were caught staring. It's actually, no, it's because you're making no eye contact or looking off on purpose in a weird way. And it's like, that's why you're getting attention for that. But the hard part, because I think we have, for most OCD, I feel really confident about treatment. If you'll work at doing what we're saying, it can be really hard, but I think you'll get better. This, we kind of partially have treatment, but I don't think it's fully articulated. So it's obviously I can't say to people, okay, well, why don't we just do exposure, stare at breasts and genitals? It's not going to work too well. So we have a few things that we do. One is called sneak peek, which is when you're talking to somebody, I want you to actually try to look at breasts or genitals, but trying to do it without being caught. Basically what everyone does, right? I mean, if somebody is wearing something really provocative, but you can't be talking to them and like looking down or whatever, but you kind of try to look down. So, and the reason we do that is to try to take some pressure off, don't look. And with Charlie Mansueto, he had mentioned something that we also try to do, which, for lack of better words, a 3-point stare. It's not really normal to just stare at somebody's eyes, make this like this, laser eye contact. So, we want them to kind of look at someone's eyes and then purposely look at the ear, look up and kind of like moving their eyes around a bit.
Yeah.
These are helpful. It takes a lot of concentration. We have seen people get better, but I don't think it's easier. The other thing, and the reason we called it visual toretic OCD, because we really made up this name for like a political reason. Because it used to be called OCD staring. Now, if you say to somebody who's caught you looking at their genitals, I have OCD staring, they don't know what that is. Yeah. They're just like, okay, sorry, you're weird.
Yeah.
But if you say, listen, like how there's Tourette's, when some people scream out, I've got this one and that, my Tourettic thing is my eyes do that. I'm really sorry. Feel free to call it out. That people will buy. So we're kind of having like an excuse to give somebody, because there's a large group of people with the visual staring who the staring occurs, the more anxious they are, the more it will occur. So I've had some people, it won't happen in session with me because it's like, oh, I'm a therapist. I know it's going to happen, so they don't care. But in a high pressure situation, they're really scared. So it's kind of like, let's have your excuse ready. Or, if you really get your nerve up, let's have you explain to people beforehand you have this symptom and they can feel free to call you out on it, trying to practice making it sound normal. So, we have some ways to mitigate it. We have some ways to practice it, but it's hard. It's harder work because it's hard to be that conscious of like, okay, sneak peek now, and to keep that on your mind constantly.
Yeah, I think we're going to see a lot more evolution in that, or in things like misophonia. Where what do you do for people who hear certain sounds that they find very difficult? And
I find that way easier.
Do you?
Well, I think that's like any hyper awareness,
Mm-hmm.
and I'm not arguing whether or not they actually find the sound more aggravating.
Right.
That might be, but there is an OC component on top of it, which is, the sound has to stop or else.
Mm-hmm.
And I think that they have to make with that. You and I both have tinnitus, and we don't care.
Right.
And yet there are people who have tinnitus and they feel like they're suicidal. And the reason is it's like, it has to stop. I can't stand it. I'm like, all right, I hear high-pitched whining. And I know I'm hearing the whining now because I mentioned it. And I know you didn't notice.
Yeah, thanks, by the way. Thanks a lot. I'm really hating you right now, very much so, just so you know.
And I know you would hate me right now if you actually cared about tinnitus. But I mean, it's that decision. I want to learn to live with it. So, So misophonia I think is easier. The staring one's hard because it's an odd one because they're engaging to behave. I mean, in a way, I don't. Is it a Tourettic OCD or not? I've got no idea. But it is. They are engaging in behavior they don't want to engage in, and they're not doing it consciously. It's not like I'm going to stare now. So it's really rough.
I'll just say one quick thing. There's a couple of people who said that there's advice about losing a loved one. A couple of people had put that in there since I mentioned Susan. I'll just say this. I've discovered almost always that the thoughts about how bad something is going to be are worse than the event itself. And I don't mean that to at all take away from the event. But thoughts sure do love to run to a worst case scenario. There were a couple of people who just talked about fears around losing a loved one. It wasn't necessarily OCD, but just because I had mentioned Susan.
Yeah. Well, it might be. I mean, I think you've gone through a terrible loss, and I had a client. I worked with this young girl. She was 17, and she was suicidal and a real mess when they brought her to me, and we got her really in good shape. She was backing off of treatment, and there was this day that her parents were driving out to the desert outside of LA to get a vacation home with, the two parents, she and her brother. Just to mention, I'm allowed to talk about this. The parents are very open. And a drunk driver on her third DUI, driving without a license, rammed their car and killed both kids.
Jeez.
And I have never had to be more careful in doing therapy because, I can't. I'm not making it. It's not like I can make it feel good. And how are we going to live? How am I going to help you live through this pain? And one of the things they said, which I'd be curious about your thoughts, they coped amazingly well. I mean, they bought the vacation home that they were going to buy that day because it made them feel closer to their kids. And they aggressively kind of they weren't thinking of it as exposure, but they thought of it as loving their kids. They wanted to talk about the kids, and they really went after it. And at one point, I would say that they coped amazingly well, and for maybe a year or more, the only good thing about coping was that it was better than not coping.
Right. Yeah.
And the father, if you live in New York, you can see this next week. He actually wrote a monologue that he's performed called "Grief: A One-Man Shit Show,"
Wow.
which is amazing. I mean, he's able to, it's not, it does rip your heart out, but it's not just brutal rip your heart out. There's humor in it and love and that. And he's written a book that has literally just come out this week about coping with the grief, and they talk about aggressively sharing and talking and having community. They said like people would be scared to talk about our kids, because they might upset us, and he's like, we're constantly, it is never not on our mind.
Yeah, right.
So like, sorry,
you can't be more upset, right?
Yeah. What's more upsetting is not talking about it. And
yes.
but
yeah. Well, John,
the people they love are going to die, and how they going to, we have to decide. I want to even cope with that, because to not cope with it, there is no way to not cope with it ultimately.
Right. Well, if you can believe it, that's been our hour, John. It's been a joy.
It has. So many more questions, don't
I know. We'll just have to get to them next time. We're going to make this a monthly event, everyone. We'll announce what that time will be. John and I will figure that out offline. We'll pick a Wednesday a month that we will do this. Reminder once again to everybody, tonight's webinar brought to you by NoCD. Check us out at nocd.com or download us on Google Play or iOS. And if you're looking for teletherapy for OCD or BFRBs or hoarding or tics, check us out at nocd.com again, or download that app. And we are available in the US or Canada or Australia or England. Once again, it's been a joy to have my good friend Dr. John Grayson here tonight. Thank you for joining, John, and looking forward to this being a more stable. Now, the word stable has never been associated with either of us.
I was thinking that, yeah. This might be the only stable thing we have going.
But looking forward to it. Thanks, everyone. We'll see you again in the future.